influenza. So these vaccines cover that. And so I almost cover.
Madam, I have some questions. That elderly, you are telling some of the vaccination, bacterial, viral, chickenpox, etc. Chickenpox, suppose we have not given in our childhood. Now we can take it.
You can take it chickenpox vaccine also.
That from our
But
dispensary.
Zostavax, the cost of Zostavax, that is the vaccine for shingles, नागिन, हम लोग जिसको बोलते हैं नागिन,
नागिन.
that cost something around 7,000 to 8,000. And chickenpox vaccine it causes cost of 2,000, 1,500 to 2,000. So chickenpox vaccine you can have in old age also, no problem.
Earlier days for the children, we are getting this hepatitis vaccination that may be available in a lot that one cannot afford for that. Some of 10,000 or 4,000 rupees. We are grouping together with our colleagues and this thing and taking at a time. So one bottle be open.
Hepatitis B that was.
Hepatitis B. But that time nowadays dispensary or hospital they are giving. Because there are not many patients are there. One can take and be given to other person. But our case it should be kept wastage. Or it cannot be kept in the street. So now it is available.
Yes. Single use hepatitis B vials are also available and 10% vials of hepatitis B is also available.
Our time it was not there. We have to purchase from the market and make it group.
Yes.
Then we take all together.
Yes, yes.
And for other vaccination like you're telling the elderly person, that is also we can take it. But all these costs and this medicine purchased by ourselves or it will be available in the dispensary?
No. You have to purchase on your own.
But it will be available sometime in the market also.
It is available.
Okay, the cost will be borne by us and we can push it over here. Only record we can keep it.
Yes.
Okay.
In old age, you can take the pneumococcal and vaccine vaccines. That will be better because
That schedule
respiratory
and this thing we can come and consultate with you and then accordingly we can your arrangement we make from the dispensary.
Yes.
Okay. That will have a touch every day, every
Yeah.
Okay, that is good. And Euro fever and this thing you're telling it is not available here.
No.
It is only in the airport side
Airport
where
side.
people do normally people do it. So they also take it. And for the children, those who are going abroad and this thing, earlier what we were keeping the record and searching the files and this is now the good thing that we are keeping
Card
the record
system
of
is
that.
there.
With this
And we are
everything
making online entry also. We are having vaccination.
Okay, thank you very much for all these information.
Now Dr. Ashok will enlighten us on newer vaccines.
So, we have known that what is the routine vaccination, what are the advanced vaccination. Now we'll talk about the potential vaccinations which might come, what is happening with the new diseases which are challenging us and what exactly is happening in the vaccination scenario. The first thing is, the first year of vaccination was vaccination to remove the infectious diseases. For that the whole world has come together and research and development occurs most of the time in the Western countries. So there is a lot of paucity of research also going on in the diseases which require very rapid immunization. We require immunization for what now? We require immunization for dengue, which is a problem in India, Southeast Asia, Africa and in Americas. South America, not the North and the Europe. Problem is that Europe and North America don't actually want to push in too much money into research where they will not generate much funds from the European community. Problem is that. So there is some amount of slowness happening in the research development of the vaccines. We need vaccine for what? We need vaccine for problems like chikungunya. We need vaccines for dengue fever, and we need a good vaccines for TB. So all these problem vaccines, they are known as basically three big vaccines. Basically, it is malaria vaccine. Three big vaccines are malaria. Other is basically your TB and HIV. All three vaccines are getting delayed because of these problems of lack of research, particularly in the Western community, because their focus is not on the developing country rather than development. Problem is number one, why new vaccines are not coming. Problem number two is, as I told you, the infectious diseases like dengue, chikungunya, as well as your malaria, viral, also HIV being a virus. The problem is they keep on changing. Virus does not have a single presentation to the body. See how the virus presents. The virus presents to itself with a coat, outside protein coat. There are multiple coats, M, M, P, all these coats are there. These coats keep on changing with that change of genes. Virus are turning their genes at will. That is known as mutation. So because of this changing of the genes, the protein which is over the virus keeps changing. So we don't have one injection for that virus forever. Because if you develop an injection, requires lot of money in investment, and suddenly we see that that infection which is for which we have spent 20 years, suddenly after a year that injection is of no use. That's the practical problems. So that is the reason why we are lagging behind in the development of these vaccines, particularly viral vaccines. Okay. Now come to the bacterial side. I'll take some vaccines and I'll tell you something about what is happening. In bacterial vaccines also, particularly TB, the problem again is the population of the TB patient is in the developing country. Research has to happen here in India because we have the burden. Today paper you see maximum burden of TB patients in Asia is in India. No research in India, we are depending on the West for research. For TB, it is not happening, so that is why we don't have a clear-cut vaccine, very good vaccine for TB. There is a vaccine for TB, BCG is there, but BCG does not offer you a good immunization, particularly in the old ages, particularly in the adults. It's good for the infants and good for a simple environment. When it is complicated environment, you have TB along with compromised situation or something else, we don't have a good vaccine for it. So let's come to TB first. So TB, as I told you, the problem is with the lack of development. We have funding of both the Western companies which have developed a pre-qualified vaccine. Pre-qualified vaccine means they have not yet got the approval of WHO. All the vaccines which I'll be calling basically are all pre-qualified. They have not actually come in the market. They have finished the trials, phase 1, phase 2, phase 3 trials. Some results have come. Based on that result, they're talking what is the efficacy of these medicines. So about TB vaccine, TB वैक्सीन को ज़्यादा बढ़ाने के लिए, उसका एफिकेसी बढ़ाने के लिए, they are using a genetic technology now, okay? DNA vaccines. So this I'll talk about the different patterns of vaccines which are coming up later. Okay, DNA vaccines are basically which are going at a gene level. They go at a gene level, induce the changes in your gene so that your body itself produces the antibodies for that particular change which you are making in the gene. So this immunization actually comes as a small change in the, they make a small change in the gene of us so that we produce antibodies to them even before getting infected. So when the organism comes, we are already loaded with the antibodies. Okay. Now they have come up with a vaccine which is known as RTS. Okay. And this vaccine in the clinical phase 3 trials have seen to be doing pretty good. In infants, they have given it in 4 divided doses. That is 3 doses to be given every month. 4 doses to be given after 1.5 years. That is 18 months. So total you give 4 doses of this DNA vaccine. It has shown good efficacy in infants. Okay. So that is a prospective thing. Hopefully this should materialize and it should become a qualified drug. Okay. Now come to dengue. Now the problem at dengue, I have told, is a virus. Virus keeps changing its coat. Again the same problem, the burden of the patients are in the poor countries. Now, for that also they have come up with a pre-qualified vaccine, dengue virus, okay? Now dengue varix, okay? Now this vaccine is also basically effective, but the thing is it is not effective for somebody who is not contacted the dengue. That is pre-exposure is necessary for this vaccine to be effective. Matlab, somebody who has already had a dengue, you give them this vaccine, then in that case basically the patient does well. That is pre-exposure to this vaccine is recommended for this vaccine to be very effective. Okay, that is, or it is not recommended for somebody who doesn't have a dengue, not recommended for somebody who is not traveling to an endemic place, or not recommended to anybody basically without any risk factors. So recommended to somebody who's having a risk factor. What is that risk factor? Already in the endemic area. Then also it is not routinely given, even in endemic area. That is, pre-exposure has to be there for this virus to be given. It is again given into 3 divided doses, 0 start dose, 6 months later 6 second dose, and then you make the last dose in after 6 months. That is, in a year you give 3 doses of dengue virus. Again it's in the clinical phase 3. Doing well, hopefully this should again come out in the market, but the limitations are pretty much there that it cannot be given for anybody to prevent dengue. Okay, that's your dengue virus. Now, the another very important virus which is very important is malaria. Now, malaria again, the set of problems are the same. Poor country, unhygienic situation, lack of sanitation, the burden of the patients are all in the poor countries. West does not bother about making the research and development. Still, NGOs have come up. Belinda Bills Gates, naam सुना होगा आपने? Clinton Foundation, that Bills Gates Foundation, they have pulled up a lot of money